This week, during our conversation with a potential podcast guest, we ended up talking about clinical professionalism and the differences between the types of care and the different experiences that you have in professionalism sometimes as it relates to the environment. And for those that are in the post-acute space, maybe more specifically home health, brace yourself. We're going to talk about some real honesty. And obviously anything that we talk about and discuss is obviously is not a blanket statement across the board in terms of, it's not every single one of the clinicians, nor is it even the majority of the clinicians. But from our own experiences, both from mine and many others, it is enough of a presence that there's an associated stigma to that particular area of healthcare. And so circling back is that, it can be fairly alarming how frequently you struggle with home health nurses and other staff that are kind of quote unquote playing the game of dollars and cents when it comes to or pitting agencies against each other. So, for example, a nurse will be employed at 2 home health agencies and will take a shift or a case with one agency and, of course, I think with good intention, plan on going and taking that case if nothing else comes up. The real, concern is that in the time frame they've committed to taking care of this patient, or handling a particular shift, they may get a call from their other employer, the other home health agency, and that call offers them more dollar per hour, or maybe more of a guarantee in number of hours, whatever the situation may be. And ultimately, oftentimes, regardless of how close it may be to that shift or that case, some of the clinicians and staff in the home health industry historically will decommit from the one agency and take on the case or the shift that is offering them more money and more guaranteed hours. Of course, now with that being said, we understand the reality of you want to maximize the number of hours you can work, the amount of money you can earn. We get it, right? There is an important consideration when it comes to being able to care for your livelihood. But the overarching concern there is that may not really be the case. It may just boil down to what has unfortunately became a little bit of an industry standard. And so as a non-clinician and being in the operations and business development side of healthcare, I would challenge the scheduling staff, administrative staff, leadership inside of home health to really begin to shift the expectations for the quality of staff, clinically speaking, and otherwise, of course, that you're looking to put into the field. I understand there are a tremendous amount of challenges having enough staff, enough qualified staff when it comes to skill set to care for patients. Of course, there is still a shortage throughout the industry, but the longer the industry allows the negative stigma, but perhaps also accurate stigma of a less of a professionalism or a less of a commitment to kind of quote unquote sticking to your schedule, the industry will continue to struggle with it. And so when, this scenario, I'm sure many agency administrators, directors can relate to. You say that that nurse is called out for the last time. We're not going to, book her anymore. And inevitably, a week or two or a month later, you get stuck in a bind and you've had a last minute call off from a regularly scheduled nurse. You want somebody you're familiar with. I get it. And you slowly creep into kind of those inactive or terminated nurses, but they still have qualified skill set, valid ZPR card, all of the clinical things that you know are in place and still certified in the areas they need to be, but they obviously kind of burned you that last time. And the truth is that the industry and the challenges in the environment lead you to make that phone call. And you call that nurse and you ask her and she comes through for you. And she's kind of back in your good graces. And you've now just slightly cracked that door to lowering the quality, right? And at the end of the day, we all take that moment and say, oh, we're just going to do it this one time. But the truth is that like anything else in life, once you've kind of opened the door a little bit and then it turns into, kind of the floodgate, then this is very similar and it gets a little bit easier every time. So that nurse may get a second chance or the next nurse may get their second chance. And it becomes just all too easy to continue to give them chances and not have some of these nurses who take it less seriously, have consequences to what they're doing. And I think until the industry as a whole is willing to take a stand and or work through an ideal solution to being more efficient at this process and or not sacrificing quality, I think it will continue to be an ongoing struggle. And so, my ask, both of myself and some of the other podcast guests will have is that obviously we're not suggesting a situation where if the patient is clinically in danger or is clinically at risk, if a well-trained or a properly skilled nurse there, that you don't consider sending nurses who are qualified, even if they may have not been the most reliable in the last 30 days or so. But what we are suggesting is that in those cases where that the patient will otherwise be okay until the next scheduled shift, if it's either something a guardian can handle and or there's an alternative option, we encourage you to set the tone and establish the quality that is important for all agencies in the industry as a whole to bite the bullet, take the unbillable hours, and make it up in other areas if it means not giving that clinician, that staff, that second or third chance that potentially opens up your floodgate. We would love to hear from you on this topic because we recognize that we're only touching really one side of the coin here and certainly not a black and white subject by any means. So if you have thoughts, comments, feedback, I'd love to hear them. Feel free to comment through your favorite podcast, or if you're listening on the Anchor station, you could actually reply back directly and or send in the audio clips. Thanks for listening to your first dose of Get Hydrated. On Monday, we have an interview with a guest who was a director of nursing in Texas. Thanks for listening to Get Hydrated, the podcast about the people of healthcare.